if I'm a freshly graduate nurse,
Yes.
what tips you like to give me to get a job?
Oh, this is one of my kind of specialty areas, and I'm really passionate about helping international nurses to get a job in Australia.
I've been a bridging coordinator. How was your experience with the international nurses? What changes you noticed in last 25 years in when they do the placement?
Yeah.
What kind of what the facilitator will be observing like
Oh,
the student is performing? One question Rahul asked from us is it easier to get nursing jobs in city or in small towns?
I think that if you can name a specialty area, you would probably find someone offering a master's in that area.
How she can come and start teaching over here, and
Sky's the limit.
we'll start. Hello everyone, my name is Sachin, and if you are new to this channel, I am a registered nurse and working in Adelaide from last 2.5 years. And we are today with Louise Sheehy, who is one of our registered nurse working from last 25 years. I'll tell a little bit more about her. I'll be a little bit brief. She's working as an associate lecturer in University of Adelaide in Sydney. Sorry, I'm more into Adelaide, so my mind is in.
That's okay. That's okay.
Yeah, so she's working as an associate lecturer in University of Sydney and a registered nurse with more than 25 years experience with clinical nursing and teaching. Her clinical experience includes infectious disease, oncology, palliative care, aged care, medical and surgical nurses. She has extensive teaching experience in various nursing education settings, including Master's, Bachelor of Nursing, Diploma of Nursing, and worked as a course coordinator for the bridging program for overseas nurses seeking registration in Australia. First of all, thank you so much, Louise. And presently, she is also doing her PhD. And the research which she's doing is really interesting. We met through the research. She's doing her research in exploring the transition and working experience of international qualified nurses working in the aged care sector of Australia. Thank you so much, Louise, for joining us.
Well, thank you for having me, Sachin. It's a pleasure to be here with you today.
If you would like to add something else in your introduction, feel free.
Well, that was a lovely introduction, and thank you just for going through that. I must admit, it does make me feel a bit old when we say more than 25 years of experience, because it seems like it's just gone really quickly. And yeah, sometimes it's just hard to know where that time goes. But yeah, I'd love to, I can tell you a bit more about my experience if you like.
Yeah, I'll be happy to.
Sure.
A little bit more.
Great. So I started nursing, it was in the mid-90s, and I actually started nursing working as an enrolled nurse. And enrolled nursing is now an 18-month diploma course.
Mm-hmm.
So I originally started as an enrolled nurse. I loved the working experience so much, and it just really felt like it was a good fit for me. So I pretty much jumped straight into my bachelor's degree in nursing, and I did that through the University of Technology, Sydney. And I then started working, this is sort of like in the later 90s, as a registered nurse. So my nursing experience, it is diverse, but I've sort of mainly worked in medical areas, and I really enjoy working with chronic conditions. So I've mainly worked in areas like oncology, palliative care. I worked in a chemotherapy unit for a period of time, which was a wonderful experience. And yeah, I worked with infectious diseases in the late 90s. So that was working with mostly with HIV patients, but also hepatitis and other bloodborne illnesses. I guess through default, I've also kind of done some aged care nursing, but it's mainly because I really love that medical nursing model where we're working with patients with lots of chronic conditions. So that's my clinical experience. I would say that I have two passions, and my passions are number one, nursing, and number two, teaching. So I feel that I'm quite fortunate that I'm able to work in a job that just feels like it's me to a T, where I can combine that nursing and that teaching experience. So, yeah, I've been teaching now for, I want to say about 20 years in different teaching positions. So those positions range from what we might call a clinical nurse educator in a hospital. I've worked at a nurse educator level in a private hospital system. And I've also taught a diploma of nursing for enrolled nurses. And I'm currently teaching a bachelor's degree and master's degree in nursing.
Thank you so much, Louise. So, first of all, what the question presently going on in people's mind is, how much is the demand of nursing and demand of nurses in Australia? What do you think? What's the present situation?
The first word that comes up for me is huge. So I would say that we have a huge demand for nurses in Australia. And that gap that we really have is really for skilled registered nurses. So Australia really needs qualified, experienced and willing registered nurses from overseas. And I would say that especially with the pandemic, obviously that did make it hard for a few years because Australia, like most countries, had the borders closed for a period of time. Now that things are opening back up again, I would say that there's just a bigger need than ever to get some skilled, qualified, experienced registered nurses here.
Yeah, I surely agree on it.
Yeah.
Well, I actually had a chat with my friend and I was talking to her and I was just asking what questions I should ask from you or what I should know more about you.
Sure.
So the question which she asked me is, what changes you noticed in last 25 years in nursing?
That is a great question. And I really have to sort of stop and think about that because you really think, wow, so much has changed and at the same time so little has changed. But the first thing that comes to mind for me is that I really think that as nurses, we are more evidence-based and our practice is really founded more in evidence-based practice. So I would say that over the last 25 years, there is more of this this desire and this sort of, look, what is the evidence? How can we improve what we are doing as nurses? Why do we do it the way that we are doing it? You know, is there a better way that we could be doing? Is there something that we're not seeing? So I really think that evidence-based practice is something that's really increased in the last 25 years. So much so that we kind of know that as Australian RNs, it's in our standards of nursing practice now that we need to think critically and to analyse our nursing practice. And that involves using the best available evidence at the time. So, yeah, evidence-based practice is one thing. Another thing that comes to mind is that I really think that there's more leadership opportunities now for nurses. And what I mean by leadership is also specialised nursing positions. So I would say when I started, we had clinical nurse specialists. We probably had a handful of nurse educators and we had nurse unit managers. We maybe had a handful of clinical nurse consultants. So one thing that's really changed, and again, I think this is for the better, is that we now have clinical nurse educator positions. There are more and more positions for nurse leaders, especially for clinical nurse consultants. So nurses have really become the leaders, the clinical leaders in areas like wound care, rehabilitation, cardiac nursing, vascular nursing, specialised areas like ICU, paediatrics, so on. Another thing that's really come in terms of that nurse-led practice is the development of nurse practitioner roles. And I really think that's amazing because we've got just some wonderful expertise within the nursing profession. So I think it's great that we can actually see that being used, being really sort of tried and tested clinically. And I really think that patients and departments are reaping the benefits of that nursing expertise.
Yeah.
One more thing I thought of over the last 25 years. I will say I do think that there's more paperwork than what there was before. And that paperwork comes with positives and negatives. Yeah. So, yes, a big component of the paperwork, it is embedded in that evidence-based practice, which is indeed a positive. I guess I do just question sometimes, are nurses so busy with paperwork that we sometimes forget the true essence of nursing, which I really see as caring and empathy. And I guess I worry sometimes that if it's not charted, do people forget to do those things? I guess that's just something that I question from time to time.
Yeah, I agree, because half of the time you are just being on your paper or on your computer and documenting it, whereas we would have taken care of a patient at that time.
Yeah.
I believe the same.
Just something I wonder.
Yeah, I totally agree on that. So one thing which someone asked from me is, as you have been a bridging coordinator, how was your experience with the international nurses?
Oh, fantastic. And I just want to start by saying that first and foremost, I really admire anyone that is able to just go through this journey, to go through the process. You know from experience, Sachin, that journey, it takes quite some time. So from that time that someone thinks about, hey, I'd like to go and be a registered nurse in Australia, it's quite a process. You know, there's a lot of paperwork. Things take longer than you think. So I just really want to start by saying that I really admire anyone that sort of has that persistence to do that. Those skills needed to do that paperwork is also what you need to, I guess, make that journey succeed and to be a good nurse as well, because it takes patience, it takes courage, it takes hard work and persistence. And that's, I think, why we see that a lot of the nurses that migrate, we might think of them like the top tier nurses, because all of those skills that you need to be able to do that are what's sort of going to help you succeed. So I just wanted to say that first. It's a great experience to work with international nurses, and I admire anyone that's going to do that. I really think that our international nurses, when they come to a country like Australia, their knowledge and their expertise that they bring with them is also amazing. And I think we really need to look at, we start by recognising that experience. There's a few things that we can maybe talk about what it takes to succeed when you migrate to a country like Australia. But I think we need to start by saying that they come with the skills, the experience, and the personal qualities and attributes to succeed. And that's why I really liked my job when I was doing that role as the course coordinator, and why international nurses are a great group to work with.
Thank you so much, Liz. So the other thing which I have a Telegram group and we have a member, Marpreet Kaur. She asked me, like we have been talking on the group about this. She is working as a nursing educator in India in a government sector from last 10 years. Now she's doing the OBA program and she has cleared her NCLEX. Now she's coming to Australia soon. She wanted to know, like, she has been working there from last 10 years, how she can come and start teaching over here, and how she can use that, like, if, for example, her 10-year experience, will that be counted in terms of experience over here? How it can be counted?
Sure. Great question. And well done for her to wanting to make the journey. Absolutely. The previous experience is counted. And also, I just want to remind people as well, remind your listeners that remember that in a country like Australia, we work a 38 or 40-hour week. So it's really good to look at what we might call hours of experience rather than years of experience, because what we might say is 10 years of experience working in a different country. If you're working more than a 38 or a 40-hour week, which is probably likely, that experience might actually translate to 11 years or 12 years of experience. And yes, it absolutely needs to be counted. So in terms of that experience, please get that evidence from employers, an official letterhead from hospitals or workplaces where you are, saying how long you've worked there. But a good tip would be to put the working hours, how many hours per week, or, along those lines to add up. In terms of getting into an education-based role in Australia, I think that's a really good opportunity. So once you have your APRA registration and you're up and running as an RN in Australia, the first or the most simple qualification to do, we call it a training and assessment certificate. And sometimes if you go into Google or you look online, we might also call it a TAE. It should really be TAA, training and assessment, but they call it a TAE. And this course is the equivalent of a Certificate 4. We also used to call it a Train the Trainer course. And once you have that certificate or that qualification in hand, it makes you a qualified trainer and assessor in Australia. So people might like to start out, for example, training staff on the ward, like on the nursing floor, for example, teaching and assessing basic life support. That's the qualification that you need under your belt to do that. So that qualification only takes a couple of months. Shop around, because the cost can kind of vary, I would say, and there's different providers for that. The other thing to look into is definitely, if you're really committed, I would recommend doing a master's in education. I did a master's in adult education, but other qualifications are masters in education in nursing, and various universities will offer that. So highly recommend it, but if you don't want to commit to sort of doing that level just yet, definitely look into the TAE qualification. Only takes a few months, and that's what you need to be working in education.
Thank you so much, Louise, for this. And next one, there's this thing called, I don't know, it is not in common, but I talked with you about it, conversion program. But as presently we are, if an international nurse want to come, they can't do the bridging. And now we have OBA or masters leading to registration. And there's some word going on conversion program. What you would like to say a little bit more about it? Yeah, we know there's not much information available.
Yeah.
But asking you what we can say.
Sure. Look, at the moment, Sachin, I probably confess I don't know too much about it. I just know that there's one or two providers that are still running a bridging program, but my understanding is that they're pretty much coming to an end, and that's not sort of going to be the way forward for much longer. The current plan, as you mentioned earlier, is mainly looking at NCLEX and sort of like an OSCE style exam. Now, there may also be a couple of universities that are offering a specific program, but I must admit I'm not too familiar with those at the moment. They do keep changing things, which is very frustrating because we do need nurses. So I would probably just look around, see what's on offer. In terms of universities, most universities will have on their websites the entry requirements. and it's pretty standard. So looking at English proficiency, such as OET or IELTS. If you have previous qualifications, such as a bachelor's degree, we could look at recognition of prior learning, but I think the nurse would need to get information on, when you say recognition of prior learning, what exactly does that mean? How long are we talking about? You know, because a standard bachelor's degree is 3 years. If a nurse from overseas has a bachelor's degree, there's no reason why they should be looking at 3 years if they have the English language proficiency.
Yeah, actually, I had chat with a few of the universities. So what I did, I just emailed them and just to check whether they have something version. I got the same response of getting the prior learning credit points.
Right.
And as like presently over here, it's 3 years. If you apply and you get your credit, it can be like almost 1 year.
Right. Right.
And I think the requirements were the same of the English and the rest of
right.
it. Yeah, so the other thing what I want to know is, as I have had chat before with you before, if I'm a freshly graduate nurse,
Yes.
what tips you would like to give me to get a job?
This is one of my kind of specialty areas, and I'm really passionate about helping international nurses to get a job in Australia, because I know that it's an area of concern for the nurse, for the family, and just after the time, the effort and the money that's been invested in the journey. These are things that nurses could do to set themselves up for success. So I've got a few tips, and I've written out a few things because I thought it's really important to take the time for listeners, because I think a lot of people would have a question similar to this. So my first piece of advice is do your research, look at areas where you would like to apply. Just start thinking about things like, why would you like to apply there? What would be good about working for this organisation, for example? And obviously you've got to take into account the organisation you're applying for, but also the wider community where you're going to be fitting into. Because when we come as nurses, we're not just coming as individuals or as professionals. We come with our families, and, you know, it's important to sort of look at structures, what's important for you. So start by having a look at where you want to apply. Do your research on the organisation, especially look at things like online on their websites, their mission, their vision, any sort of core principles that they might have, and try to find out what you can about the organisation. If possible, try to find out who to address your application to. So it's always better to receive an application that's worded to someone personally. So it might be Dear Mr., Dear Mrs., rather than receiving a generic Dear Sir or Madam, or to whom it may concern. And I must admit, sometimes I've received an application, and when someone hasn't done their research, they'd say, Dear Sir. And I think, I don't know about this. This person really hasn't sort of looked at what they're looking at here. Second of all, have a good CV. Now, a good CV with Australian standards, or what Australian employers are looking for, is no more than 3 pages. Okay, and I know it's tempting to sort of put together a mini encyclopedia of experience, but the fact is they're just not going to look at it. On your CV, just start by listing very basic information: your name, your contact details, your address, phone number, email. Try not to list personal experience, personal things on your CV. So in Australia, we don't tend to list things like religion, hobbies, things like that. List your experience from overseas, and try to make it as specific as possible. So if I was applying for a job, I might say, for example, oh, I worked at Royal Prince Alfred Hospital in Sydney. Now, if you're a local, you would probably know what that meant. But if you're addressing it to someone, I think I've never heard of that before, you would say things like, look, this is a 700-bedded multi-speciality teaching hospital. I worked in a 30-bedded oncology ward. Okay, so try to really detail that experience. Think about things like hospital size and bed numbers and where you worked. If possible, list out your main responsibilities as well. So that was my first 2 tips. So do your research on where you want to work. Second one, have a good CV and really take the time to do those things. In terms of interview, so the next step we're looking at is interview practice. I have a couple of tips about interview. So first of all, I would say that Australian interviewers, interview questions are likely to be what we call behavioural-based questions. It's highly unlikely. It doesn't mean to say it won't happen at all, but it's highly unlikely for you to get a very specific knowledge-based question. So they're very unlikely to ask something like, can you tell me the exact mechanisms of this particular drug, what the side effects are, what the contraindications are? Can you interpret this ECG rhythm for me? It's more likely to be things like, what are your strengths? Why would you like to apply for this job? Why would you be a good candidate to work for us? So I would say really take the time to think about that. Think about you as a person and as a nurse, your strengths, things that you're good at. And on that note, I would just add that I think in all cultures, we have been kind of raised and brought up from the time we're little, where someone says, look, don't go around bragging about yourself. You know, you can't go around telling people how good you are at this and that. But this is an interview. It's not real life. So have a think about it. What things am I good at? Maybe even ask your colleagues or your co-workers. You know, it might be a strange question, but what do you think I'm good at? Because I think you don't want to get to that interview and they say, tell me about your strengths. And the person goes, I just think that's not a good look. So, yeah, take the time to think about that. So in addition to behavioural-based questions, the other common questions are scenario-based. So scenario-based questions are things like, can you tell me about a time that you managed this? Or what would you do if this situation was to arise? So I'd say they're the most likely questions. Try and incorporate your experience as much as possible. And I would just say that keep in mind a new graduate nurse can answer a question with the theoretical knowledge of what that answer should be. An experienced registered nurse can give the theory, but plus say, you know what, I have done that and here is what I did. So try and sort of think about those things when you're answering the question.
Yeah, I agree on it. The way you're telling me, I can imagine, yeah, what interviews I had, and it was exactly the same. First question is always, what are your strengths and why you applied for this? And then they'll be saying, okay, this person had this and this, and now what you'll be doing on it. Yeah, I totally agree on it. So other thing which I wanted to know is, so for in my home country in India, we have, after doing your bachelor's, they have some specialties, masters. It's only in particular, like either you are in med surgical or community health, mental health, nursing, pediatrics. If I have done my bachelor's, I'm working as a registered nurse over here. What specialties or what masters in what field I can do masters over here? Like, I've seen like acute care, critical
Yeah.
care. What would you like to say on it?
So many. I think that if you can name a specialty area, you would probably find someone offering a master's in that area. So I do know that we have a lot of nurses that have done a speciality in intensive care, for example, or high acuity nursing. We also have a lot of specialties in regards to things like palliative care, aged care. Again, if you're working in an area like oncology, that might involve giving like chemotherapy medications and things like that. I'm also aware of masters in terms of cardiothoracic nursing, which I know is an area cardiac nurses are very passionate about what they do as well, and paediatrics. And look, there's probably a 1,000 more, but I do think that that's an area, as I was saying, it's really emerged for nurses, leadership opportunities, specialty areas. I think if you're interested and you did a search on it, you'll probably find someone will offer a master's degree in that.
Yeah, I totally agree on it. And now the other question is, if like we were starting about the leadership roles for nurses, what they can do for that?
Oh, for leadership opportunities, that's a great question. So first of all, I'd say most organisations, they will offer like a facility-based leadership program, and that might look like doing an on-site leadership course, a preceptor course. That is usually like a hospital-based or facility-based course. I'd start by doing a couple of things like that. When I was working as a nurse educator, I had a statistic that was something like 5% of nurses will regularly involve themselves in some kind of professional opportunity, some kind of professional development opportunity. And that means that it was usually the same percentage of nurses coming forward saying, oh, I saw this course, I'd like to do it. And it was just a matter of saying to the employer, hey, I found this. And they'd go, yeah, of course. Most employers will also usually have something like a study leave or support you in that professional development. So that might mean that they will usually pay for the course and also pay you for your time. Start by looking into something that's organisational based. If there's nothing there, then I'd probably go out a bit wider. You can also do a certificate in leadership and management, or even a master's as well in nursing leadership. So lots of opportunities. Start small, see that you like it, approach your employer, get the support. If you like it, go bigger. Because only 5% of nurses, I would still say, are regularly involving themselves in that. And yes, I know that we have 20 hours of continuing professional development. 20 hours is not a lot. 20 hours is basically saying, hey, I kind of did the bare minimum. I did what I was told to do.
Yeah.
Take the opportunity, because if you do a 3-day workshop, do you know what I mean? That could be a leadership based. Hey, that's 24 hours. You've done that in 3 days. Yeah. The opportunities are there for those that are keen.
Yeah. And the other thing which I wanted to know is, like, everyone one time they'll be seeing their pay, how much they are getting money.
Oh, yeah.
So if you might have seen a lot of people growing in nursing, what you would say if someone wants to earn more in nursing, or someone wants to take a job where they pay more as compared to a normal person working in hospital?
Yeah.
What do you would like to say to them?
Sure. Look, I don't have a problem with that. I think that, again, nurses are highly skilled. What I would probably recommend, and this is speaking as a nurse educator, and having seen people that have jumped around a lot, My first tip would be to set up a really solid foundation of working experience. Now, by solid foundation, I would probably recommend on first arrival to a country like Australia, I think it's really important to get a good solid chunk of a few years of experience. I would think of that as being 2 to 3 years with one employer as a permanent thing. If after that you're looking to change, go for it. You know, have a look, see what's on offer. Look at the factors and the options that are open to you, because pay is important, especially in this day and age. But I would also look at opportunities for professional development. If I was in this role, is there a scope for me as a nurse to sort of do a different role, to take on another thing? You know, is there somewhere that I could sort of see myself moving up? I think those things are really important for peace of mind. In terms of short term, I know people are worried about money. So obviously looking at different shifts and things like that can help. In the long run, I would think about opportunities higher up. And I really think in Australia, one of the great things, age is really no barrier. If you are determined and you want to take on that higher level position, if you've got the determination and the drive to do it, you'll succeed. You know, I mean, I started at the age of 25. I took on a nurse educator hospital level, which is a nurse educator level 4. I was 25 years old and I was the youngest person in the hospital. But the only difference is that I had the drive. I sought a higher qualification. Age is no barrier. That's my advice.
And one question was from Sandhu. Like the surname might be Sandhu.
Yes.
What do you think nursing is or was a satisfactory job for you at the end of the day?
Oh, look, I can only speak for myself, but nursing fits me to a T. I know I have a lot of family and friends and they say things like, oh, I don't know how you do it. Oh, I could never do that. I'm thinking, are you kidding? Like, nursing is a great job. We get to see people, we get to care for people. We see people at their worst. And I always go back to that sort of saying that nurses see people coming into the world. You know, we're there at that first moment that life comes into the world. A nurse is there when someone leaves the world. And we see and we hear and we care for everything in between. And I think it's an honour. So, again, I can only speak for myself, but I think it's a wonderful job and I think it's a privilege.
Yeah.
Yeah, I also just think that there's so many opportunities for nurses. It's not that a nurse is a nurse is a nurse. You can go to so many different areas and you can continue sort of working in different areas. You will find your fit, I think.
One question Rahul asked from us is it easier to get nursing jobs in city or in small towns? Like sometimes in hospitals.
Yeah.
I had a chat with a few of my friends. Like, getting into hospital in a metro, sometimes it's difficult if you don't have any experience.
Look, I think it can come down to experience. But having said that, I think with visa requirements and things like that, I think most nurses coming have a good the average amount is about 3 to 5 years of experience before coming. Mm-hmm. It can vary from person to person, but I really think that the opportunities are available everywhere. There was probably a time and a place where I would have said, yeah, look, it's probably easier in Australia to look at remote areas, to look at regional areas. That's definitely still a possibility. But I really think at the moment it depends on the nurse, that nurse's family, what you're looking for. I really think that the opportunities are available everywhere at the moment.
If we talk about like this, we are talking about as international nurse who have 3 to 5 year experience.
Yeah.
We're talking about who has done their bachelor's of nursing in Australia and they
Yeah.
are freshly graduate
Yep.
without any experience.
Okay. Yep. If they have done their bachelor's of nursing in Australia, their best bet is to look at applying for a graduate program. And a graduate program will offer that support for the new graduate nurse. And the good thing about it is that it also usually offers a few rotations where, I remember I was still trying out different areas, seeing what was a good fit for me. And I really liked the benefit of sort of being able to move around a little bit. So most graduate programs are for 12 months. And they usually have at least 2 or 3 rotations where you can try out different areas. So for an international nurse that has qualified in Australia, I would apply through those sort of graduate pathways, if possible.
Yeah. I think in Adelaide, they call it the transition program.
Right, yeah. Different terminology. I don't know why we do that in the same country, have different things by different states.
Yeah, everywhere. I've noticed that like they'll be calling something and calling something and
same.
So other thing which like as you have been in the teaching field, just to give an idea about what's the difference in pay of an RN working in a hospital in acute ward?
Yep.
What if I'm working as a nurse educator in a university or in a college or anywhere?
Sure.
Can be the pay difference?
Yeah, look, so it's a hard question to answer because again, it can vary by state. In Australia, we usually have a structure where with each year of experience, your base rate or your hourly rate will increase. And again, that experience should come with you from overseas. And let's say a nurse has 3 years of experience, they should commence at that appropriate step, which would be an RN3 or 3 years of experience. Now, the hourly rate or base rate keeps going up until you normally hit what we call RN8, meaning RN with 8 years of experience. And sometimes we call it 8 years and thereafter. From that RN8, each higher level position that you do is incrementally higher pay. So from RN, you might then move up to clinical nurse specialist or clinical nurse educator, clinical nurse consultant, nurse educator. It really depends on that scale. But again, I just say that age is no barrier. You also don't have to wait for 8 years before you apply for specialty jobs. So you could be a very enthusiastic RN with 3 or 4 years of experience. You show the experience, you show the drive, you're a clinical nurse specialist. And I just want to say that from my years of working with international nurses, I'm still in contact with many nurses. Now my nursing colleagues, back then they were students, qualified from overseas, of course. We have international nurses that are working as directors of nursing. They're working as clinical nurse consultants. I'm regularly in contact with a few nurses. So one I know is working as a clinical nurse consultant in what we call the flying squad, where they go and see from the hospital level, see patients in aged care facilities. And that role is really like a nurse consultant role. We've got a couple of nurses that are working as directors of nursing at both hospital and aged care level. We've got a lot of nurses that have succeeded. And again, they've got the drive, they've got the passion, and that's how they've done it.
Yeah. One, as you are teaching to Bachelor of Nursing students as well, the thing which I wanted to know is when they do the placement, what kind of what the facilitator will be observing, the student is performing. Because when I did my placement in Melbourne, it was a little bit tough for me because it was my first time I was in Australia and I wasn't even not sure what she's looking for. Later on when I came to know, okay, this is what you're looking for. So what the facilitator will be looking for?
Right. So in my multitasking nurse educator and academic roles, I do also do facilitation. So I do facilitation currently for bachelor students and previously for internationally qualified nurses doing the bridging program. For bachelor's level, we are obviously looking at safe practice. And again, bachelor's level, they have different placements depending on the unit that they're studying, and there are certain goals that they try to achieve. The bigger picture, like especially for the internationally qualified nurse, what I love to see is when I come onto the shift and that nurse has a plan of what they're doing, they can see that bigger picture and they say, right, so today I'm looking after, it could be one patient, but these are the nursing tasks or responsibilities. These are the things that I know I need to look for. And I love kind of piecing together the pieces of the puzzle with the student. So let's look at the person's diagnosis. Let's look at the medications that they're on. Let's look at this plan of care for the patient. What is it that we're trying to achieve? So if they can kind of really start to see that bigger picture of patient care, I think it's fantastic. Obviously, in terms of practice, we need to see safe practice in all areas, especially around medications. I'm really hoping to see good assessment skills. And I think something that I have to work on with our bachelor's students sometimes is to just kind of remind them that, hey guys, assessment is an ongoing thing. It's not we do it once, we tick that box, we did that. Now let's never do that again. Assessment is always there. It's ongoing. What's changed? What can I see? What can I hear? What can I feel? Sometimes what can I smell? What did I do about it? And then what action was taken? How did that impact what we're doing? Let's reassess. That's something that I really love to sort of see.
Yeah. Now you have told me what she was looking for when I was on the placement.
Really? Okay. There you go.
I came to know what exactly she was looking for. But in starting, first of all, the thing which is a communication barrier because of language. We know the language, but catching the accent is a little bit a big task.
Right.
You might have noticed it with your international students. When, sometimes even the nurses, even the teacher who is teaching us, they think, don't they understand? Why don't they understand the accent? But it's really hard because first of all, it's not our first language.
Of course.
We will be only talking in English in school or at our workplace.
Yeah.
Then getting the accents. Sometimes like the slangs. Would you like to say something about Australian slangs?
Oh, I'd love to say something about slang. So I think every nurse that comes to Australia, communication is always, I don't want to say an issue, that's the wrong word, but it's something that they experience. And obviously this nurse has come achieving a score of proficient English level, which is no mean feat. I mean, that's a hard thing to achieve. But what's hard about language, and in particular the English language, is that there are lots of different, what we might call the nuances with language. We look at accents, we look at the speed in which people are talking. And I mean, I'm sometimes aware too, I need to say, oh, am I talking too fast? Because when I get excited, I can do that. I can just talk too quickly and I need to slow down. The other thing that Australians love is slang. So Australians have a very bad habit, shall we say, of shortening everything. So breakfast would become brekkie. A lot of things when patients are asking for something, they say, oh, it's time for a cuppa. And I'm seeing this nurse standing there going, I don't know, what's a cuppa? And a cuppa is a cup of tea. Why we shorten it, I couldn't tell you. But it's one of those fun things about language. I would just say on that note too, please don't hesitate to ask, because it is a bad habit that Australians do when we use this kind of language. So just say, look, I'm really sorry, I'm not familiar with that term. Can you explain it to me?
Yeah, I agree. And like my experience was when I started working.
Yeah.
There was the word which I got was reckon.
Oh, reckon.
We see in English, pure English, in our books, we don't see that word anywhere, reckon. My fellow nurses were speaking, I reckon we should do this.
Yeah.
Then I got
What does that mean?
Okay, that's what she's saying. Think. I think we should do this. Okay, all right, I got it.
Right.
Like when I used to go to see my patient and they used to say Hawaii.
Yeah.
Hawaii will be for me Hawaii. I thought he's talking about the place Hawaii.
Yeah.
Then later on, every day he used to say the same. Then I came to know that he is asking me how I am.
Yeah.
And the other thing which I noticed over here, what Australians do is they will short your name.
They do.
Yeah. But it's all right. Sometimes it's hard to pronounce the name.
Look,
one of my one of the patient used to call me Such instead of Such because I'm all right. He is calling me with the name which I'm not sure about it. That's all right. That's what I noticed.
Look, when I just add, in terms of the name, please don't hesitate to say to everyone, to just say, look, correct them if they don't say your name correctly, because I think it's really important. And Australians, like we do like nicknames for things, but at the same time, there are kind of these unwritten rules that come with a nickname, and only certain people in certain groups can call this person that, but I might not like a patient calling me that, for example. So don't hesitate to sort of say, look, I'm sorry, my name is Sachin, or say the pronunciation correctly.
And actually, I forgot to ask one question. It was from Emma. The question was, for example, I'm an international qualified nurse. I did my NCLEX and I came over here. I started working. What would you suggest when they should do their master's or specialization? After gaining some experience or straight away?
Look, first of all, I'd say whenever you're ready. I would like to think that for the first 6 months of the job, it's a pretty intense learning period. So I would say give yourself a good 6 months, maybe 6 to 12 months, which is not a long time, to really just focus on that job. Now, we know just as adults that starting a new job, any new job, is stressful. You've got to find out the routines, you're learning people's names, you don't even know where to put your bag, things like that. Research kind of tells us that it takes us about 3 to 6 months. Those 3 to 6 months of transition are hard. Now, when you're transitioning to work in a different country, it's not just the new job. So if I move from this job, job A to job B in Australia, that's 3 to 6 months and it's quite stressful for me. But as international nurses, we're setting ourselves up in a new country, a new workplace, a new social group, a new community where you kind of you really need to immerse yourself in. So I would probably say give yourself 6 to 12 months, which is not a long time. After that, you will really feel like a weight has been lifted off. And then I think you can really dedicate your time to studies. And I think it's great that we've got nurses coming here and they already want to do higher study. It just makes me so happy. It's great.
Yeah, thank you. And now, as you have been working with international nurses, I'm pretty sure there would have been a lot of Indians.
Yes.
So one question I wanted to know is,
Yes.
even my parents will also be happy to know this.
Yes.
What if Australian hear a word called India or Indian? What are their first thoughts?
Oh, well, maybe I can speak to from myself. But one thing I've always found is that you can always talk between an Indian and an Australian about the cricket. So my first thought, the first thing that comes to mind is actually cricket. And it's quite interesting because when we have our international nurses come here, patients that you care for are absolutely fascinated. They want to know about you. Where are you from? Oh, wow. And now they're going to ask you a lot of questions, which usually pertain for Australians are food and sport. They're probably some pretty popular things.
Yep.
Is that right, Sachin? Like, what
I agree. So what's your favorite Indian food, if you have tried?
Oh gosh, I have a lot. Because my students are often surprised I like spicy foods. So we used to have at the end of our bridging course, like people would bring a dish in. So I especially like a lot of the curries, and I like the rice dishes, like the biryanis. I can't say it correctly.
Yeah, you're guessing right.
Yeah. And sometimes I've tried some sort of more local dishes as well. But yeah, they're probably the best dishes, I think. Yeah.
What if, like, I'm new to Australia? What food you will suggest me to try?
You know what? I'm kind of a little bit embarrassed to answer that question because if I'm being honest, I think one of the really good things about Australia is that we are multiculturally diverse. And what I love about that, apart from the fact that, number one, my kids, my family, get to grow up in an area that's very multicultural and they have friends, that grew up in different parts of the world or their parents were born in different parts of the world. But the other great thing about that cultural diversity, I've got to be honest, is the food. So you can go, like from where I live in Sydney, I've got Indian restaurants, Nepalese, Vietnamese, Thai, lots of different cuisines that I can sort of get access to pretty quickly. Now, comparatively speaking, if we look at Australian foods, we've got, let's see, we've got meat pies.
Yeah. One of my colleagues suggested me that. I went and tried it. It was not that too bad, and it was all right. Yeah.
What was it? What was it?
It was meat pie, which I tried over there.
Yeah.
It was not that too bad, but
like it's not a delicacy though.
Yeah.
Do you know what I mean? It would be a food that you would sort of eat on the go, or eat when you went out to a sporting event or something like that. So look, it's kind of embarrassing to say I don't think that Australians really have a great kind of cuisine. What we are good at is immersing the culture and the diversity in our food. Too good.
Because if I say, if we see around 200 years back, most of us are from outside.
Absolutely.
Most 90%.
Yeah, absolutely.
50% of living over here and people, others.
And look, that's something, it came up in Australia's last census where we collected the data that a vast majority of Australians have at least one parent that's born overseas, and again, I think it's great because it just means that our kids grow up in such a better, diverse community. And I think it's great.
I 100% agree on it.
Yeah.
Yeah. So I would say I think it was a great chatting or a great podcast or whatever we can say.
Yeah. Yeah.
We have covered many points,
Yeah.
and I think it has
Can
been.
can I end? Is it okay for me to end by talking a little bit about the research?
Yeah.
Is that okay? In
Yeah.
case anyone.
If you can share your experience, what the nurses told you about it.
Oh, I can't
How?
quite do that yet, but
Yeah,
I
like
will.
not
I will.
like just a little bit,
Yeah.
or whatever you would.
One more question that I thought we could go through as well. So, if there's any challenges from internationally qualified nurses, like when they first come, maybe if you wanted to ask me that, because I've got an answer.
Yeah.
And then maybe if you just wanted to ask about how I came into doing the research, because I've got a bit of an answer about that.
Yeah.
How did that sound?
Yeah, great. I would love to hear it.
Great. All right. So maybe did you want to look at the challenges of internationally qualified?
Challenges would be perfect.
All right. So just getting back to when I was working as the course coordinator for the bridging program, I think a lot of people might ask, what are the common challenges that internationally qualified nurses face when they come to Australia? So we kind of touched on communication, how communication, it is challenging within itself because of the way that Australians might speak, for example, and the language, things like that. But clinically speaking, one thing I would say about the Australian nursing workforce is that, first of all, Australians are not very, what you might call, hierarchical. We are very laid back. Sometimes Australians are criticised for being a bit too laid back. But we like to have a workplace that's kind of fun, interactive. Yes, we're working hard, but that doesn't mean you can't have fun and have a bit of a laugh and get along with your colleagues as well. In terms of that communication, one problem that sometimes comes up for our international nurses is around assertiveness. Now, what I mean by that is the role of the nurse in Australia is really around questioning things. What's best for the patient? Evidence-based practice. Is this in the patient's best interest? So it's really important that as nurses, part of our role is to question the doctor's orders, question if the medication might not be suitable, question if there's something else that we could be doing. And I think sometimes that's a little bit tricky. When you first start in a new workplace, you think, well, I can't really go around questioning things. But if it's a matter of patient safety, you absolutely can. And that's your role as a nurse. Just in terms of that as well, again, getting back to Australians, we're not very hierarchical. When you walk into the workplace, I would just say hello to everyone, introduce yourself to everyone. That means if I see, I don't know, the cleaner in the corridor, I would say, good morning, how are you today? If I see the director of nursing in the hallway, I would say, good morning, how are you today? You know, our approach is kind of exactly the same. So I just think that's something to keep in mind. Introduce yourself to everyone, doesn't matter who they are. Don't feel that there's someone that you can't approach or you can't talk to.
Yeah. So what about, would you like to say about your research?
Yeah, so I just wanted to finish up by saying that I'm currently, as you mentioned before, I am a PhD candidate with the University of Sydney, and my research is aimed at exploring the experiences of internationally qualified nurses transitioning and working in the aged care sector of Australia. So it's quite interesting because statistically speaking, international nurses make up about about 15 to 30% of that general nursing workforce. But when we have a look at the aged care sector, international nurses make up roughly 40% of that makeup. So statistically speaking, there's a fair difference. And it's quite interesting because when we have a look at the research that's existing at the moment, we have a handful of studies that look at the experiences of internationally qualified nurses. They're all based in hospitals.
Yeah.
So, I guess my first question is, if international nurses are making up such a high component of our aged care, I mean, let's face it, that's like the backbone of our aged care sector. Why are there no studies that are looking at the experiences? We know that migration is stressful. We know that when you transition to a new job, it's normal to experience stress. We know that there was a Royal Commission into Australia's aged care sector, and that showed us that our aged care workforce is under stress. So I really think it's so important that we meet with our international qualified nurses. We really need to hear about their experiences so that first and foremost, we can support them as individuals. By doing that, we can maybe help the workforce at large, but primarily we want to support the individuals. And that's why it's so important that we hear the experiences.
Okay. I 100% agree on it.
Thank
And I
you.
would also say that who are watching, Louise is one of them who inspired me to do what I'm doing at the moment in terms of the podcast. Because when we were talking first time, we shared our experience, and I thought, I'm having such a different experience. My journey is so different. And when I had a chat with a few others, they had such a different experience.
Mm.
So what if we share their experience with the international nurses who are coming or who are already here or who want to come?
Absolutely. And I just want to say, I think what you're doing is amazing, because this journey that people take as an international nurse, I mean, I've never done it myself, obviously, and I take my hat off to those that do it, but I could imagine that it feels so isolating. And I really think it's important to reach out, hear the stories of people that have survived, that have done that, and it's an inspiration to others, just knowing, hey, you know what, other people did this and they survived, they've gone on to achieve higher things.
Yeah.
Maybe I can do the same.
Yeah.
So well done.
In starting, everyone is facing some other challenge.
Yeah.
They are having trouble either in terms and doing the course or starting the job.
Yeah.
And if we see that someone has faced the same situation and he or she has been here from last 10 years and he has done everything good, it also motivates them that if he has done it, you can also do it.
Absolutely. And I think during those times of stress in our life, our brain plays two tricks on us. And this isn't my advice. This is something I picked up from another podcast. But the two biggest tricks that our brain will play on us in times of stress, number one, I'm the only one going through this. And that's when the negative self-talk starts of, oh, it must be me. Maybe I can't do this. Maybe I'm not good enough. Maybe it's not enough. Number two, that the problem's never going to get better and it's going to last forever. And they are the biggest lies that you'll ever hear that we tell ourselves. So absolutely you can do it. Absolutely you can succeed. And look at all the people that have gone on before you and have done this and succeeded.
So we will end this podcast through this, and thank you so much, Louise, for sharing.
Thank you. Thanks for having me.
Yeah, and we'll surely be having another podcast soon if we get more ideas or more questions.
Great.
Thank you so much, Louise.
Thanks.